It's a nightmare that just won't go away. A woman underwent life-changing surgery after she was told she had cancer. Then she learned the doctors were wrong. Here's NBC's Savannah Guthrie.
Derry Eason got the call no woman wants to receive.
There was cancer in the biopsy.
Breast cancer. The 33-year-old mother was treated aggressively with a double mastectomy. But at a follow-up visit after surgery, doctors gave her another shock. She never had cancer at all.
I just broke down and cried, and I really didn't know what happened in the room from that point on.
It turned out there was a mix-up at the lab that handled Eason's biopsy specimens. According to a letter from the New York Department of Health, a technician at CBL Path Laboratory cut corners and mislabeled Eason's tissue samples. But the problems didn't end there. State officials found Derry Eason's sample was switched with another woman who did have cancer. But because of the mix-up, that woman was told she didn't.
This other young woman has to live with the idea that she has breast cancer, and hers was not diagnosed at the earliest possible time.
Eason and her lawyer are suing the CBL Path Laboratory. In a statement, the lab's chairman says the company did a thorough investigation with state authorities who found no systemic problems and cited no deficiencies against the lab. Small comfort for Derry Eason.
Something should have been done to tell me that there wasn't anything wrong with me before I had a radical double mastectomy.
Experts at this breast cancer hotline say all women should get a second opinion, even on lab samples. For today, Savannah Guthrie, NBC News, New York.
And Derry Eason is here with her attorney, Stephen Pagalis, and NBC's chief medical editor, Dr. Nancy Snyderman. Good morning to all of you. Derry, I can only use the word nightmare to describe what you have been through, to be told that you have cancer, remove both your breasts, very radical surgery, then find out you didn't have cancer at all. When you got that news, the emotions that are going through you, partly probably relief that you don't have cancer, and then total confusion, I would assume.
Exactly. Yes. You can't even answer the question because you feel every emotion.
Every single emotion.
Yeah.
Take me back. In March of 2006, you're diagnosed with cancer. Why did you make the decision with your doctor to undergo such a radical procedure?
It was based on the type of cancer I was told I had. I was told I had lobular breast cancer, which everyone told me would always come back. And if I didn't have a double mastectomy, that I would every 6 months have to undergo, more testing to be sure that it hadn't come back.
Did you seek a second opinion?
Yes.
At the end of the piece, they said that's very important. You did?
Yes.
And
yes.
With the same results because they had the same
yes.
lab specimen, obviously. So who figured it out then? Who figured out, whoa, there's a big mistake here?
I was the breast surgeon. After the surgery, I guess they test the tissue that they have removed, and they said, hey, we're not finding anything.
So that was before you started the chemo and the radiation that was recommended?
Before, yes.
Nancy, the lab apparently, the technician who made this mistake was cutting corners, according to that report that we heard about, doing something called batching. What is batching?
When you put a lot of people's specimens in the same area and you start processing them together, and even though patients are given ID numbers and names are different, there's always that possibility that, a blob of tissue looks like a blob of tissue. You could
But why would you put them together?
Well, you don't. You do one person at a time, and you check and balance name and date of birth, date of procedure, doctor's name, hospital ID number. There's something else that patients should know here. When you get a second opinion from a doctor, don't just take the pathology report and pass on the piece of paper. Ask that the slides themselves be sent to a second pathologist for that pathologist to look at them. Because we all as doctors rely on the reports. But if you have a bad report that's then being passed around to a lot of good doctors, you're only as good as the bad information. So go back to the source and say, I'd like another hospital, another pathologist to look at the specimen and see if the original report was done correctly.
Mr. Pagalis, why are you taking action now?
We carefully evaluated whether or not we should include any of the physicians in the suit, and found out that
any of Derry's physicians.
Any of Derry's physicians, The system is as strong as its weakest link, and we did not want to include a physician who had done right by Dari, if I could use that phrase. And we spent a bit of time making certain that no physician should be included in this case.
Meredith, that's important because so many times in cases like this, there's sort of a wallpaper of lawsuits. They took their time to figure out where did the system break down and who's responsible.
Is it one person? Are we talking about a technician? Are we talking about the lab overall? I mean, who is ultimately responsible?
It may be one person, but personally I doubt it. And one of the things that we may learn from this suit is, was there a system failure? And if so, what could be done to improve the system? Personally, I doubt that this is an isolated event by someone who was careless just once in his or her life. And personally, I doubt that there are not systems that can prevent this. But it won't make Dari's case better.
Won't. But it might help the next person.
Exactly.
And I know, as you mentioned, both of you, that there's two people here involved. There's you and the woman who was misdiagnosed as well, who had cancer and didn't get treatment in a timely fashion. How has this impacted on your life? I know you're a single mom. You have a 15-year-old son who's been a great support to you, but it has to have had an intense impact.
It's you can't even explain it. There's no words how everything is impacted.
So why, it's very brave of you to speak out then. Why did you choose to do it?
I don't want this to happen to anybody else. And maybe if people hear about my case, they'll know something's happening, and maybe somebody will do something differently next time. A lab or a doctor or somebody.
And Nancy, for those watching who are thinking, it could have been me, what advice do you have?
The advice is you pick your doctor wisely, you pick your hospital, and you ask about checks and balances. Now, I say that, but as we all know, when you've been told you have cancer, your life goes spinning around. So have someone with you who can be sort of that pit bull and make sure that everything's being checked. And it goes back to the weakest link. And if that's the lab report, make sure you go beyond the lab report and have the specimen double-checked.
Dari Eason, thank you so much.
Thank you.
I really appreciate it. Mr. Pagalis, thank you.
Thank you for
Nancy,
having
as
us.
always, thank you very much.